My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment.
Poor appetite can be due to multiple reasons, including additional symptoms like diarrhea or nausea, anxiety, environmental factors, medications, dehydration, and so forth. Regardless of why you are nauseated, the important part is how we can manage that symptom to reduce weight loss and poor nutrition status. As you can see on this slide, we want to first manage any underlying symptom like diarrhea or constipation, and we will discuss how to manage these symptoms later in this presentation. After we have managed underlying symptoms, I urge patients to change their mindset from viewing food as pleasure to viewing food as medicine or using food for survival. Setting alarms at certain times in the day to remind yourself to eat can be very useful when eating just does not feel like a priority to you. Additionally, eating at the same time each day often encourages the stomach to produce hunger signals and possibly a better appetite. Start small and set realistic goals. Goals that are too ambitious are not always achievable, and that's okay. It's one step at a time. One goal I always set for my patients is to reframe their mindsets from eating healthy foods to eating more calorically dense foods if weight loss or poor appetite occurs. This means putting more emphasis on milkshakes, ice cream, and other high-calorie foods than nutrient-dense foods like fruits and vegetables. Some additional recommendations include drinking beverages between meals to reduce early satiety during meals. Always experimenting and trying new foods to spark your appetite. And remember, no food is off limits if you are faced with prolonged poor appetite and weight loss. Try to get up and move as often as you can or as recommended by your medical team. Often, increased exercise can help improve your hunger and appetite levels. Track your calorie and protein intake on a nutrition app or computer website such as MyFitnessPal or NutritionIX Tracker, seen on the right-hand side of the slide. If you are unsure of your energy needs, reach out to your dietitian. When dealing with a poor appetite, we recommend that you consume foods and fluids that provide the biggest bang for your buck. Additionally, high calorie and high protein liquids are often easier to consume than sitting down to a large meal. If you would rather eat than drink your calories, we recommend making each bite of food the highest calorie and protein bite you are able to tolerate. Lastly, if you have the best appetite in the morning or in the evening, we recommend that you capitalize on those times to reduce weight loss. If you are having trouble preparing meals or getting access to meals, there are many options available for pre-prepared and even delivered meals. You can see some of the many options here. Listed here are some high-calorie options. This list is not comprehensive, but rather a couple of options to consider. If possible, we always recommend consuming healthy fats like oils, avocados, nuts, and seeds. For certain breast cancer patients, we do recommend to limit high-fat dairy. And if you have any questions about this, please reach out to your breast cancer dietitian. Again, as you can see here, there are additional options for high calorie, but also high protein foods to implement in your diet if you're feeling unwell. Some of these options include cheese, nuts, hummus, eggs, protein powders, whatever works best for you can definitely be added to your diet. As you can see here, there are many options for high calorie and protein drinks you can utilize in your diet to help meet your energy needs. This list is just a few of what we typically recommend to our patients, but there are many more to choose from. I often recommend that these nutrition supplements are utilized like Band-Aids in terms of utilizing them to make up for what you're unable to consume at meals and snacks. For patients that may need to watch their blood sugars, here's a list of some of the diabetic-friendly supplements that are available. Reach out to your dietitian if you have any specific questions regarding blood sugar control and supplements. Now, if you prefer to make your own high-calorie beverage, we encourage you to do so. There are many ways to make your own high-calorie smoothie or shake, so make sure you customize your shake based on your likes and needs. Remember, there are no wrong answers. If you rather eat your calories and protein or just want another way to increase your energy intake, there are many ways to add ingredients to get the biggest bang for your buck. Listed here are some ideas you can utilize. Here's some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.